Let me do this again.
Yeah.
Sound rolling.
Trimacare is a one-stop solution for all the Indian mothers, and it is a very good micronutrient supplementation for our pregnant mothers, which can benefit their babies as well. We have seen in our experience that the Indian women are micronutrient deficient. Now, these nutrient deficiency impacts the pregnancy as well as the neonatal health. We know only the healthy mother can produce healthy baby. And if the mothers are deficient in any kind of nutrition, then this can alter the short-term and long-term health and developmental outcomes in the babies. So this is important for the growth, neurodevelopment, cognition, and cardiometabolic as well as pulmonary and immune function of the neonate. So mothers' deficiency should not be there. We give them a dual approach of balanced diet as well as multi-micronutrient supplement in the form of tablets or capsules or whatever. Initially, we were just concentrating on IFC, that is iron, folate and calcium, because we thought it is enough for the pregnant mothers. But nowadays there is evidence base, and now we can realize that multi-micronutrient deficiency can definitely have long-term effect as well as on the mother as well as on the fetus. Among our pregnant mothers, we find there is deficiency in iron. 90% of the women, both in the rural population as well as in the urban population, have vitamin D deficiency. 1 in 2 women are zinc deficient. 1 in 2 women are folate and vitamin B12 deficient. Nearly 30% of our pregnant mothers have deficiency of vitamin A. Omega-3 fatty acids are also deficient in our diet because a large number of population is vegetarian. Most of the omega-3 fatty acids are visible or available in fish or seafood, and definitely only a coastal mothers who stay in the coastal area, they will get enough source of omega-3 fatty acids, but the rest of the population may not get as much source. So approximately 13 to 15 micronutrients which are essential for pregnancy, along with iron, folate, calcium, magnesium, zinc, they are not present in our average Indian diet. Together with our FOGSI, which is a national body for obstetrician and gynecologists in India, WHO guidelines also recommend multi-micronutrient supplementation for the pregnancy, which also includes iron, folic acid and calcium model. Supplementation of vitamin A, B complex, vitamin D, vitamin E, copper, iodine, selenium and zinc are recommended by WHO and ICMR as well. In the first trimester of the pregnancy, when the mothers are having nausea, vomiting, and they are very fussy about their diet, still we have to take care that our mothers get enough of folate, iodine, vitamin B12, zinc, and vitamin A, because this is very crucial in the first 3 months of the pregnancy when the baby is in the embryogenesis, because that embryogenesis phase is very important. All the organs are being formed initially between 6 to 8 weeks of pregnancy. In the second trimester, when the mother's nausea and vomiting is gone, she can definitely enjoy more of variety of food in her day-to-day life. Still, we require the supplementation of iron, calcium together with 12 or 13 micronutrients, which we have to give as a supplementation to them. Again, in the third trimester, the baby is growing at a great pace. The baby requires more and more of calcium, iron, together with the other 12 to 13 micronutrients. We need to give the mother enough of magnesium, vitamin E and vitamin K. So we have to understand whatever mother takes that benefits the baby. Now, during pregnancy, if we give multi-micronutrient supplementation, it improves baby's growth, survival, body composition, blood pressure, respiratory and cognitive outcomes as compared to iron, folic acid, calcium supplementation. Because nowadays we are talking about fetal initiation of adult diseases. Because if the baby is having micro multinutrient deficiency, this can reflect in the adulthood as hypertension, diabetes, obesity, and all these other problems in the adulthood of that baby. So, nutrition of the mother is so important to look after so that the baby that she's carrying has a healthy childhood, healthy adulthood as well. It is more effective in reducing maternal anemia, improving birth outcomes as compared to IFC alone. It also reduces the risk of low birth weight, small for gestational age, and stillbirths. We understand that iodine helps in regulating growth, development, metabolism via the biosynthesis of thyroid hormones including T4 and T3. We have to understand that thyroid hormones are very important for the fetal brain development and nervous system. And because this will have a long-term effect on the baby's cognition, intelligence, IQ, as well as the growth and development of the baby. Early in gestation, thyroid hormone production increases by 50% and renal excretion of iodine increases by 30%, while 50% later in gestation, iodine passes the placenta for fetal thyroid hormone production. Deficiency of iodine can result in miscarriage, preterm birth, stillbirth, low birth weight, and other complications. Not only that, deficiency of iodine can lead to neonatal hypothyroidism, which we will not understand, neither the neonatologist will understand. But it is so important that initially 4 weeks of the baby, if it is a subclinical hypothyroidism also, that will have long-term effect on the cognition of the baby and the development of the baby. Magnesium is important for both for the mother as well as for the baby. In addition to the requirement by the fetus, renal loss of magnesium is a major concern of magnesium requirement in pregnancy. We often hear that the pregnant mothers, they complain of calf pain, and this is because of the magnesium deficiency. So supplementation of the magnesium treats the calf muscle cramps and hypertension in pregnancy. Every pregnant mother requires 240 to 480 milligrams of magnesium daily, and this requirement should be continued again till she breastfeeds her baby. Zinc is another micronutrient. It is important in the biochemical function including protein synthesis, nucleic acid metabolism, as well as the cellular division, gene expression, antioxidant defenses, wound healing, vision, neurological and immune function. If there is a deficiency of zinc in the pregnancy, then it also leads to impaired immunity, prolonged labor, preterm birth, fetal growth restriction, low birth weight, and pregnancy-induced hypertension. Omega-3 fatty acids are very critical building blocks of fetal brain and retina. And consumption of fatty acids during pregnancy, either in the diet or via supplements, is associated with improved neurodevelopment outcomes in the child, because the brain matter, white matter, is only formed out of the fatty acids and omega-3 fatty acids in the diet. And omega-3 fatty acids plays a vital role in determining the length of the gestation and in preventing perinatal depression. Vitamin D is very important for utilization of calcium. So if the mother is deficient in vitamin D, there is problem in bone formation of the baby. ICMR recommends 400 international units of vitamin D per day. Supplementation recommended daily requirement is enough for overall maintenance. Vitamin D plays a role in maintaining calcium homeostasis, bone integrity, and it is important for optimizing maternal and fetal bone health and for supporting fetal growth. We have to tell our mothers that iron-rich diet is all kind of dal, green leafy vegetables, gur chana that we say, this is very important and rich in iron, as well as we have to guide our mothers to take what to take which is rich in iron. All non-vegetarian food is also very rich in iron, but most of the mothers are vegetarian and their intake through the diet is not appropriate. So we have to give supplementation. Most of the mothers, they do not take even iron capsules properly because they do not understand the importance of iron during their pregnancy. But if we have to give them, because they do not tolerate iron capsules also because of the nausea, vomiting, as well as for the constipation part. Because we have seen the iron capsules loaded with 60 milligram or 100 milligram of iron. But this much iron per day in this supplementation is not taken by the body. It goes down the drain. Only 12 to 18 milligram of iron is absorbed in the body at one time, and that also in the ferric form. If we are giving heavy doses of iron in the form of 100 milligram, then it just causes side effects like gastritis or constipation or loose motion or black stools. So what we have to plan is if we are giving supplementation, we give lesser dose of iron in the supplementation. And absorption should be planned in such a way that it is planned in a slow release or time release formats, which is along with the vitamin C, which helps in the absorption of iron, along with the vitamin B12 and B9 for treating anemia in our mothers. ICMR guidelines prescribe 500 microgram of folate per day, but most Indian women are folate deficient and have poor intake of green leafy vegetables in their diet. So we recommend at least 5 milligram folate supplementation during the day, during the first trimester, and continuing with 500 microgram per day for the second and the third trimester. Higher hemoglobin levels are achieved with L-methylfolate since it is the active form when compared with the folic acid. The L-methylfolate is so important instead of taking just simple folic acid because 40% of the women may not be able to convert this folic acid into the active form because of the gene mutation. And normally when we are checking our pregnant mothers, we are not doing gene mapping for the patients. So we do not know which mother will be utilizing the folic acid or which mother may not be able to utilize the folic acid in the active form. So it's so important to give L-methylfolate or the active form of folic acid to a mother as a supplement so that they can utilize the vitamin itself as such. Calcium is very important for the bone development of the fetus as well as for the mother. If we are not giving calcium supplement in the diet or as a supplement, then the baby will take away the calcium from the mother's bone and the mother will have deficiency in her later life in the form of aches and pains in the bones. ICMR recommends that a pregnant mother should consume at least 1200 milligram of calcium per day. But the body cannot absorb more than 500 milligram of calcium at one time. Common Indian diet, which is rich in milk, curd, chapati, ghee, cheese, they can give some amount of calcium to the mothers, but definitely 500 milligram of supplement is required and this should be encouraged in the diet. All the micronutrients can be compressed into one tablet, then there will be more adherence for these mothers. They do not want to take 2 or 3 tablets, one vitamin tablet, one iron tablet, one calcium tablet. If we can combine all the 3 into one tablet, maybe the patient adherence during pregnancy will be better. So we want to have some one kind of tablet which can provide all the micronutrients which is so essential for the pregnant mothers, and so they can adhere to the therapy and they can take it very nicely. Most of the mothers nowadays are also working. So if we tell them take this tablet after lunch, this tablet after dinner, so it is very difficult for them to remember also. So if we combine everything into one capsule, then it is easier for these working mothers to take the capsule and to adhere to the therapy so that they can take benefit of the supplementation throughout their pregnancy. Trimacare is designed specially keeping in mind the nutritional requirements of Indian pregnant mothers. Its components are based on the ICMR guidelines and gynecological recommendation. A one-stop solution of 20 plus nutrients including 60 mg of iron, 500 mg of calcium and 5 mg folate. It has advanced salts, higher absorption and again plant-based nutrition. So it is very important for the mothers to get one capsule with all the micronutrient requirements for them, and this they can adhere to, they can carry on throughout the pregnancy, and they can take the maximum benefit throughout the pregnancy as well as for the babies as well. Trimacare is a one-stop solution for all the Indian mothers, and it is a very good micronutrient supplementation for our pregnant mothers which can benefit their babies as well.
Choose trimester-wise care. Choose the right nutrition for Indian pregnant mothers. Choose Trimacare.